A warm welcome to everyone joining today's webinar. My name is Jitesh Kadia, and I have the privilege of serving on the board of the British Asian Trust. We are a charitable foundation driven by the South Asian diaspora in the UK, and highly fortunate to have His Royal Highness, the Prince of Wales, as our royal founding patron. Since the beginning of the pandemic, the British Asian Trust has hosted a series of high-level webinars as part of our BAT Insights program. And I am delighted to welcome you to this important and timely session today, focused on the COVID-19 vaccines. Before turning to our main topic, I wanted to take this opportunity to provide a quick update on the work of the British Asian Trust. As well as harnessing the strengths of the diaspora communities in the UK, we are fortunate to enjoy the support of some of the most incredible philanthropists, families, and foundations across South Asia. I'm delighted that one of them, Adar Poonawalla of the Serum Institute of India, is joining us today. Together, we have been able to make a positive difference to those most in need. And to date, our projects spanning education, health, child protection, conservation, and livelihoods have helped more than 5 million people across the region. At times like this, our organization is more important than ever. Last year, through our COVID-19 appeal for South Asia, we raised almost £1 million and were able to support more than 150,000 people with emergency relief and essential frontline services. We know that in the months and years ahead, our outcomes-based approach will be needed more than ever as we seek to build a successful post-COVID world. To help us with this, I'm delighted to say that we have secured a partnership with the UK government, in which the government will match fund every pound that we raise in March, April, and May this year. So please do look out for this appeal. With every donation doubled, it will enable us to continue reaching some of the poorest and most marginalized people across South Asia. With that update on our work, let me turn back to the focus of today's event, namely the importance of the vaccine and its take-up by the Black, Asian, and minority ethnic communities in the UK. We know that BAME communities have been disproportionately impacted by the pandemic, so it is even more important to address any issues of mistrust, misinformation, or other structural or cultural barriers leading to vaccine hesitancy. To explore this topic, I'm delighted that we are joined by such an esteemed panel, including my parliamentary colleague, Nadhim Zahawi, and of course, our host, news presenter on BBC Radio, journalist, and BAT ambassador, Ritullah Shah. We are particularly grateful to His Royal Highness for his active support in shining a light on this topic, in helping to dispel myths and allay concerns, and in encouraging everyone to take up the vaccine. It therefore gives me great pleasure to introduce His Royal Highness, the Prince of Wales.
Ladies and gentlemen, in view of my concern about the health and welfare of our ethnic minority communities, I'm so glad to be able to introduce this crucially important discussion on vaccination. I am indebted, I must say, to my British Asian Trust for organising this, and also to our highly valued speakers for giving their time to take part when I know just how incredibly busy they all are. Everyone present today represents the collective effort we have made as a society to combat this relentless pandemic. Over the past year, we have all been inspired by innumerable accounts of dedication to duty, not only from those working tirelessly in our marvellous National Health Service or in social care, but also in all forms of public service, as well as, of course, in business, industry, commerce, and the voluntary sector. We have needed every last reserve of their selfless service and commitment to help defeat this pernicious threat. Recently, I fear we have reached a most sobering milestone in this seemingly interminable campaign as we marked the tragic loss of 100,000 souls. it is clear that the virus has affected all parts of the country and all sections of society. But it is also clear that there are particular challenges faced in particular sections of our society, especially in some ethnic minority communities. What saddens me even further is to hear that those challenges are being made even worse by the variable uptake of the vaccines, which finally offer us a way out of the suffering of the past year. The production of the vaccines in such an incredibly short timescale must rank as one of the greatest scientific achievements of our time, and has been the result of tremendous international cooperation, generous financial investment by nations and private companies, and represents an unprecedented and superhuman effort by our medical experts. Therefore, it is surely a tragedy that the benefits of such an extraordinary achievement should not be experienced by everybody, which is why I am so very grateful to all those who have come together here today to help ensure that people of whatever background are enabled to take up the vaccine and that any barriers to its adoption can be removed. There are many success stories in this field on which we can build. Many of those administering the vaccine have come out of retirement to work tirelessly to help their communities in their hour of need. Places of worship of all faiths have become vaccination centres for all members of the community. The Al-Abbas Islamic Centre in Birmingham, the Neasden Temple in London, and Blackburn Cathedral are just a few of many hugely encouraging examples. Over the years, I have become increasingly convinced that deep-seated and often intractable problems are always most effectively addressed when we work with local communities to understand their context, their concerns, and their realities, and then to build their trust. It is an approach that works, as my Mosaic initiative has powerfully demonstrated, working with Muslim communities and their peers to encourage social mobility for young people and communities alike. So I am enormously heartened that with this vexing issue of low vaccination rates, we can call upon the ready and heartfelt commitment of those who have not only the most preeminent expertise, but also, crucially, the understanding of and the respect of their communities. Therefore, ladies and gentlemen, I want to send you my warmest thanks for all you are doing to help those most at risk. Vaccination will save lives, will prevent serious illness, will protect our health service, and will allow us to start to hope that things might return in some sense to normal for every member of our society. As you undertake this absolutely vital work, I can only wish you all every possible success in coming to the aid of our ethnic minority communities, for whom I hold the greatest affection.
Thank you very much to our founding patron, His Royal Highness, the Prince of Wales, whose opening remarks, I think, have very well set out the ground that we hope to cover during this morning's conversation. I'm Rithala Shah. I'm a journalist and broadcaster. I've been an ambassador for the British Asian Trust for more than a decade. I'm delighted to be chairing today's discussion about the importance of the vaccination programme against COVID-19. I hope this will be an opportunity, in a sense, to really discuss the facts about vaccines and some of the concerns that many people in communities across the country have raised. And I hope that we can really offer reassurance to people who have concerns. Our panel are all at the forefront of the effort to beat coronavirus and to roll out the vaccination programme. Let me introduce them to you. Nadhim Zahawi is the Conservative MP and the Minister for COVID vaccine deployment, and also the Minister for Business and Industry. We're also delighted to have with us Adar Poonawalla. He's the CEO of the Serum Institute of India, and he's at the front line of vaccine distribution in India. I'd also like to welcome Professor Kevin Fenton. He's the London Regional Director of Public Health England. Professor Farida Fortune, CBE, is Professor of Medicine at QMUL and Barts Health. And Dr. Nikita Kanani, MBE, is Medical Director for Primary Care, NHS England and NHS Improvement. And we're also going to hear from Sadiq Khan, the Mayor of London. Welcome to you all. Thank you very much for your time. Before we begin, a quick couple of things to point out. We've received a number of really good questions already, which we will try and weave into the discussion. But if you have other questions that you would like to pose, please do type them into the Q&A box at the bottom, and we'll try and get in as many as we can. And just to flag up that this is being recorded, so it will be kept online or on record. That's all the housekeeping that's been done. Let's get the show on the road. Adar Poonawalla, I'm going to begin with you because, as the Prince was pointing out, there is a very uplifting part of what has been a pretty grim health crisis, and that is the story of scientific endeavour and triumph. The rapid deployment of vaccines has been extraordinary and an amazing achievement. The Serum Institute of India is producing more COVID-19 vaccines by dose than I think any other facility in the world. At the moment, it's the Oxford AstraZeneca vaccine. For some people, the fact that this has all happened so quickly seems unsettling, unbelievable, bewildering. It's something to worry about. Describe for us how vaccine development has been possible quite so quickly.
So firstly, a very good morning to you, all the ministers, lords and participants and the British Asian Trust. It's great that we could put all this together because it's important to get the right messaging out there with so much news and conjecture going on. So firstly, to answer your question, we have always been building capacity ahead of time. In fact, when I took over as CEO in 2011, that's just what I've been doing because I've been looking at these diseases and other diseases emerging due to our traveling habits, climate change, and so many other factors. And so that was one of the reasons why I had empty capacity in buildings, which I could quickly rejig and buy equipments in record time, which even astonished everybody because, generally equipment also takes time to order and install and buying those glass vials and all that sort of stuff. So, we did break a lot of records in being able to put that together. Another thing that saved a lot of time, and, people were wondering, did we rush anything? Did we overlook anything? No, absolutely not. The safety trials, the efficacy trials were all done in the same way that we do other vaccine trials. It's just that it all happened parallelly. So, for example, animal testing and laboratory testing and regulatory permissions were coming in simultaneously, bringing down those years that normally would take in a non-pandemic situation. So these were some of the reasons why we were able to act very, very swiftly.
And why did you make the decision to go with Oxford AstraZeneca so early on?
Well, we already had a relationship with Oxford and the great scientists there because we're working on them on a malaria vaccine, which is now into phase 3 trials in Africa. So naturally, when we heard them announce this in the news and we were talking to Adrian Hill and his team, we said, let's try and come together because eventually if they were to succeed, which they have, you would need large scale manufacturing. And that's where obviously it was a fit. And we came together in a matter of a week and, put in agreements in place and started doing a technology transfer and moving on.
Stay with us. I want to bring in Nadhim Zahawi, the vaccine minister. The vaccine program is moving ahead very rapidly. I think just less than 24% of the population have now had a jab. My birthday at the end of March, it begins with a 5, and I'm very much looking forward to a vaccine as my birthday present, fingers crossed. But again, coming back to this question of speed, what processes have been put in place to ensure that the vaccine is safe?
Good morning, everyone. Thank you, Ruthula. You're absolutely right. And when the regulator in the United Kingdom, the MHRA, under the fantastic leadership of June Rain, first of all, with the Pfizer-BioNTech vaccine, if you recall, which we deployed at the beginning of December of last year, and then, of course, with the Oxford AstraZeneca vaccine, they effectively communicated with the world exactly how they had gone through the different phases of the trials, phase 1, 2, and 3, and of course working with the Joint Committee on Vaccination and Immunization to make sure, as we've just heard from Mr. Poonawalla, that there were no corners cut, there was no sort of shortcuts taken. It was basically the ability to parallel the different studies, because government had put so much resources in terms of funding the scientists to do their work, and of course the ability to do large scale, both in the United Kingdom and in other parts of the world, trials of the vaccines that allowed us to do this. But they were absolutely rigorous, and they are independent of government. The MHRA is our regulator. It's recognized as one of the best in the world, and look at this very thoroughly before they give approval for any vaccine. And of course, we are about to receive our third vaccine, the Moderna vaccine as well, which has also gone through the same rigor as the Pfizer-BioNTech and the Oxford-AstraZeneca vaccine.
But just to be clear, to anybody who's concerned that the UK is ahead in this race because somehow it's cut corners, it's approved vaccines before everybody else, what reassurance can you offer?
Absolutely, that the regulator here actually held a press conference for both announcements in terms of the two vaccines that have been approved, and now a third with Moderna, and took the world through exactly how they did it, the work of the experts that they always employ in whatever approvals they provide. And it was the ability to parallel the trials that allowed them to do their work, but without actually changing anything in terms of how they approve vaccines from sort of pre-COVID world. So the regulators, again, I would repeat, is independent of government. We can't have any influence on their work. They have to do their work properly, nor can the manufacturers. So this is all done in a way that I think is the right way to protect people. Vaccines are protecting about 2 to 3 million people a year. And of course, now the COVID vaccines hopefully will begin to do the same thing as we roll out. We're now last night, we're shy of 16 million people getting their first dose of the vaccine.
And a quick clarification before I bring in the other panel members, something that a number of people have asked, but I think is quite important to this conversation. Naresh Sinha of Stalybridge Mossley and Duncanfield Primary Care Network raised this. He asked, what is the take-up rate among minority communities? And he talks about BAME, and it's a term that I know lots of other people have actually said they don't like, but what is the take-up rate among minority communities compared to those who are actually eligible as a whole?
So we now, as part of the vaccination program in the UK, collect ethnicity data. We don't have a sort of a system that looks at refusal rates, but we can obviously know what the adult population is. The UK adult population has the highest level of positivity in terms of intention to be vaccinated. So amongst the adults in the UK, the ONS study had us at 85% of adults saying they will very likely or most likely take the vaccine. I think there was an Ipsos Mori survey last week showing 89%, which is very high. The risk really, and I think it was identified by His Royal Highness the Prince of Wales as well, is the 11% or 15%, depending on which study you look at, that have vaccine hesitancy skews heavily towards BAME communities. And we've seen some studies where certainly in the first 4 cohorts, which is the most vulnerable people and those who look after them, that double the number of white people in those first 4 cohorts were taking the vaccine versus, say, Black and Afro-Caribbean communities, which is why we're spending so much time. On the 13th of February, I launched our Uptake Strategy, which looks at several strands of evidence. One is the ability to access the vaccine to be made much easier for those cohorts, especially in the top 4, whether you're in social care or healthcare, because you are in those top 4 cohorts. Now we're obviously moving on to cohort 5 and 6 in the 9 that we have from the Joint Committee for Vaccination and Immunization. So access is incredibly important. And we're looking at ways of making it more accessible. You heard from the Prince of Wales about the Al Abbas Mosque in Birmingham, East London Mosque doing tremendous work amongst the Bangladeshi community, and of course the Al Hikmah Center in Batley, cathedrals, black churches, temples, and so on, because people don't only want to hear from people that they trust. So, medical practitioners who are from their community, but also places they trust. I was in Hackney with Diane Abbott last Saturday, and we witnessed something quite amazing. The Hatsola ambulance service actually bringing out the Hasidic Jewish community to vaccinate at 8:30 at night on Saturday. We did 364 vaccinations, including some of the Muslim community in Hackney as well. It's those voices from the community organizing the vaccination program, backed by the NHS, backed by their local government.
Well, let's bring in Professor Kevin Fenton. I mean, the reason we're having this conversation is because there is some evidence of this lower uptake of vaccines among minority communities. What specific issues have you seen among Black communities that is perhaps proving to be a barrier to going and getting a vaccination?
So, thank you, Richard. I'm the Public Health Director for London, and we've been doing quite a lot of work with our communities in the city to understand hesitancy, but most importantly, to respond to it. And the good news is that we are seeing improvements over time. So even among communities that were most hesitant a few weeks ago, as more people are getting vaccinated, there's more confidence in the vaccine, people's safety concerns are being addressed, and there are more conversations happening between peers, family members, colleagues about the vaccine, and I think that's building confidence. There are 3 key drivers that really prevent communities from engaging with the vaccine. The first is around trust. For communities that may have had a challenging relationship with the healthcare service, or are mistrustful of government, or mistrustful of authority and their experiences with other health initiatives, then they're going to be less likely to want to step forward for the vaccine at this time. And that's why we need to do a lot of work to rebuild trust in communities, being truthful, having authentic conversations, and taking the time to listen to their concerns. The second issue that we're seeing are some of the issues related to the myths and misinformation which are circulating. And in this regard, social media has been a key pillar channel for disinformation. And so our work in London and across the country has been around ensuring that there's clear, consistent, culturally competent information using languages and images from a variety of communities that speak directly to those communities. And then finally, as you heard from the Minister, access is also an issue as well. You can provide the vaccine, you can do your mobilization, but if people don't know where to go or how to register or how to leave their communities to get the vaccine, then they won't take it up. And that's why some of the fantastic initiatives across the country of really working with community centers, looking and working with faith institutions are going to be a key part of addressing hesitance in our communities. So this is not insurmountable. Working together, listening to our communities, and having a plan is going to be a key part of encouraging all of our communities to take the vaccine.
Professor Farida Fortune, if I can bring you in, could I ask you to describe the disproportionate impact that COVID appears to have had on South Asians, and in particular Pakistanis and Bangladeshis?
Yes. I think you don't need to have the figures. You just have to look in your mind's eye. When I walked into ITU at our hospital the first time at the peak of this pandemic, I was so shocked. I was absolutely shocked. Not only is there 40-bed ITU, not only is there another 4 of them, but when I looked down the ward, everyone looked like you and like me. And that realization was absolutely amazing. the mosque, the imam came around every day. Also the Jewish rabbi comes around every day. But there's this constant flow of people who look like you and me, and then they disappear again, and another lot come. And they are those who are unconscious. I think that's fine. Those that are not unconscious, the absolute fear is just awful. Somebody grabbed hold of me, and you're in a mask, you got gloves, some of them are never going to see your face again, and says, please tell me, am I going to live? They keep on taking people away. I never believed, he said, that this hospital had anyone in. I thought people like you were lying. It is just absolutely devastating. And, in some parts of the country, people have not actually had neighbors or anyone get it. But in this, we have 2 rounds of losing family members. So you can't blame the community for being so scared, so mistrustful, because they think you're going to the hospital and you're going to die. So what happens is that they come in late, all right? And, as Professor Fenton was saying, where you have inequalities and poor resource, whether it's health, economics, or social, you're going to have worse outcomes. And we know that this community around us has really poor health outcomes. And the Imam and I at the East London Mosque 5 years ago were looking at the figures. So you can't, that's why the community has done so badly.
There's so much I'd like to pick up from those points that have just been made. But before we continue the conversation, let's just take...
Hello everyone. I'm delighted to send a message for this important event hosted today by the British Asian Trust. This pandemic has sadly inflicted a heavy toll on our communities. The latest data suggests that British people from a South Asian background are up to 5 times more likely to die from COVID-19 than their white counterparts. This is why it's so crucial that we're doing everything we can to protect ourselves, our loved ones, and our neighbours from this terrible virus. And that includes getting vaccinated when the time comes. History shows how effective vaccines are against deadly diseases, and the same is true of the COVID-19 vaccines. They are safe and have been through exactly the same rigorous testing regime as any other vaccine, including the flu jab and ones you're likely to have received at school. I know that, like so many others, when our turn comes, my family and I will be getting vaccinated. In fact, my mum has already had the vaccine, which is a huge relief for my family. I'm also so glad to see our religious communities playing a leading role in the vaccination effort, with temples, mosques and gurdwaras throwing open their doors and hosting vaccination centres. They're a shining example of the British South Asian community at its very best. So please, when you're offered the vaccine, join millions of others and take it, not only for your own sake, but for the benefit of everyone you care about and hold dear. Thank you.
If I can bring you in, Nikita Kanani, I was going to do a bit of a quick fire round, picking up from some of the points that the Mayor was making and indeed Farida Fortune was making about this idea of mistrust. There are lots of really basic but important questions that have already come in to us, one of which is from Shahida Begum, very direct: is the vaccine safe?
Thank you, Ridula, and thank you, colleagues, for this incredibly powerful event. Can I just say to our community leaders who have joined us today, I can see in the chat bar there are many people who've been working with their communities to promote uptake. Thank you for what you're doing, because actually without you, we wouldn't be able to get such a good uptake already, and that is absolutely key. We need good role modelling and good messaging in the community to make sure that people feel confident in taking up the vaccine. And the vaccine is safe. Each vaccine that has been approved by MHRA, as Nadhim said, has gone through very rigorous testing, actually testing that's happened at the same time rather than tests that happen one after another, which is why it was quick, but we needed it to be quick because the risk of COVID infection is much, much higher than the risk of anything that the vaccine could do. And I want to be really clear about that. The risk of COVID infection for our communities is ultimately hospitalization or death. The COVID vaccine protects you from those two things more than anything else. And so when you are offered the vaccine, it's really important that you take it up and then you talk to your family members as well. I'm very blessed in my family. My elders have had their vaccine. They were confident in having the vaccine. And now we can talk to others and say, you too can now have your vaccine because it's safe to do so. So with in answer to your question, both vaccines that we currently have are safe. Any further vaccines that are approved by MHRA are safe. And it is fine to get any vaccine that you are offered when you are offered it, because that is what's most important, because that's how you're going to protect you and your loved ones.
Okay, I'm going to throw a couple more sort of quite basic but important questions that have come up. Can the vaccine affect fertility?
Absolutely not. And actually, what's really important to remember here is when you are pregnant and you get COVID, you get very, very unwell. So having that vaccine while you're pregnant, we are offering it to people who are pregnant, is really important because it is more important for you to have that vaccine before you're pregnant, actually. So again, really, really important. One of the biggest public health initiatives that we have alongside clean water is vaccination. So that vaccination is safe. It also doesn't contain any animal products, and we've had really excellent support from BAME and others that say that the alcohol content in the making of the vaccine is considered below the levels that would be of any concern, and really clearly no aborted fetus lines as well in the vaccine, so safe from many aspects.
So just to repeat, and that was going to be my next question to you, no animal products in the vaccine at all?
No animal products, no fetal cell lines, and absolutely fine to have if you are considering having a baby, but it does not affect your fertility. This is something that is really important to do, like taking your vitamins and minerals to protect your health and to protect your family's health.
Farida Fortune, another question that's come up quite a few times is it okay to mix the vaccines? Perhaps is it even better to have one jab from one and one jab from another?
I think you should have the vaccine. So when you have your vaccination, you will get a card. All right, the card will say what you've had. And I would say to anyone, and just reiterate this, there's no human and no animal product in it. And I would have the vaccine that is offered when you go and have your vaccine. And I think the people around you are not the experts. The people who are giving you the vaccine are.
Lots of new variants being discussed. Professor Kevin Fenton, a lot of concern about those. Inez from Accenture says her dad's 70, but hesitant to get vaccinated because he's unsure whether the vaccination will be effective against these new variants of the virus. What do we know about that?
Thanks, Ritula. So I can completely understand her father's concern. I think one of the things we are now seeing are these new variants which are appearing, and there's beginning to be evidence from some research studies about the negative impact on the effectiveness of vaccines. Now, the good news is that these variants and these different strains are at very, very low levels currently in the United Kingdom. So the predominant strain, which causes COVID and which is causing the transmission, are very susceptible to the vaccine. So the vaccines are very, very effective for the dominant strain that we currently have in the United Kingdom. And that means taking the vaccine now, protecting yourself and your family now, so that you have the best protection against the current strain is exactly the strategy. Now, as the year progresses and as we have a better understanding of different strains, we know that the vaccine manufacturing companies will be adjusting their vaccines and ensuring that they keep in lockstep with how the virus is changing. So again, just to summarize, the most important thing is when offered, take the vaccines which are available now, because they will protect you from the most dominant strains which are circulating, thereby preventing severe disease and death.
Nadhim, Zahawi, does that suggest that this could become a 3-vaccine year?
Well, we are at the moment obviously deploying the current vaccines, and as you've just heard quite rightly, the dominant strain in the UK, the current vaccines are very effective against. But we're also working with the current manufacturers because they're also looking at vaccine variants that would deal with virus mutations or variants. But also, we've just signed a very important deal with a company called CureVac, which does messenger RNA technology, where we're going to be able to, using our very strong genome sequencing industry in the UK, we account for just under 50% of all the sequencing that's been done on the COVID-19 virus and its mutations, work with them to be able to be ready with any mRNA vaccine and manufacture it in the UK rapidly, so that if we need a booster for the winter, then that will be available. And then, of course, the scientists are already thinking about an annual COVID vaccination program and how that would obviously work with the annual flu vaccination program. We've got another vaccine that is coming through, which is developed in Scotland, or manufactured in Scotland. It's the Valeneva Vaccine. It's a French company. It's a whole inactivated virus that makes up the vaccine. Again, that we have announced a further deal with Valeneva for next year, because we're looking at not just obviously vaccinating the population now and keeping them safe, as Nikki Kanani described, but also looking to the future, that we future-proof our vaccination program against COVID annually.
So that, I'm going to take that as a yes. It seems likely that we have the 2 jabs to get the protection from the first round, and then quite potentially a third vaccination against the new variants as they emerge in the autumn.
Well, as I say, the scientists are looking at all of that at the moment, and we want to be ready. That's the most important thing, is that we have the technology and the manufacturing capacity in the United Kingdom to be ready for any future variants that we need to deal with from COVID. And of course, then possibly the science suggests that an annual vaccination program could be appropriate.
Adar, Poonawalla, you had your vaccination, I think, very publicly. How important was that as a way to build confidence?
Yeah, so I think that was very important, and there was nothing really to hide, and it's I've taken every vaccine, from the first few batches that I've ever made and our company's ever made. It's very important also that we maintained this very important point that I just wanted to add to the professor, that the existing vaccines at the moment that are licensed do protect against severe disease, even for the new variants. So in South Africa and the other places where, there was this talk about, for example, the AstraZeneca Oxford vaccine was not protecting you, it was a little skewed in its communication, because it allowed mild to moderate disease, but it did not have anyone being hospitalized, going on a ventilator and going into a critical state of life-threatening situation. So, that is some silver lining that I just wanted to highlight from the existing vaccines. And, as Professor said, that when we tweak the vaccines at the end of this year, we will further improve on that performance as well. And, that's the sort of situation we're in. So these new variants should not really create a panic, because, once the traveling opens up, you are going to see different variants emerging in different parts of the world. but we should maintain that at the moment, these vaccines are protecting you from severe disease. So that's important to maintain.
Dr. Nikita Kanani, how important is it that people get vaccinated now?
As colleagues have said, now is when we're seeing the pressure on the health system and on families, actually, most importantly. Last month alone, we had over 100,000 people in hospital with COVID. So please, as I think Farida said, please don't think that the hospitals are quiet and people are not getting COVID. People still are. So getting that vaccine now, if you're offered it now, is absolutely right. There is a priority list, mainly based on age, but other factors as well, including health conditions. And so when you're called up, it's because it is your time to get called up. And then having the vaccine, it's really important. In the chat bar, there's a couple of comments about what do we do afterwards. Well, you must still social distance, because until we see the evidence clearly saying that this stops transmission of the virus, we still have to continue social distancing, wearing our masks, washing our hands and keeping our spaces, even though we all want to get back to our usual family sort of events and times together. We are not there yet. So we maintain our social distancing until we get the second dose, which is 12 weeks after the first dose.
I want to pick up, though, on this question of trust, which I think Farida Fortune mentioned. This week, I think a new predictive risk model was introduced, and essentially it will help clinicians identify adults with multiple risk factors that make them more vulnerable to COVID-19, and deprivation and ethnicity were among the factors. And there's now 800,000 more adults will be prioritized to receive a vaccine. Nikita Kanani, that question of trust in government, trust in health, it's quite deep-seated. How do you overcome that?
So it is deep-seated, absolutely. And we know that people are anxious about taking the vaccine for lots of reasons, but particularly because of trust issues. And so as somebody said in the chat bar, this isn't about blaming individuals. This is not an individual's fault. We need to create a vaccine program and ways of communicating that support everybody to have confidence about taking up the vaccine. That is our job, and we're committed to doing it. But that trust goes over, I would say, centuries, actually, where people have been tested on inappropriately, really traumatic experiences in communities. And actually what we want to do, what we need to do, is move past that to make sure people get the vaccine. And what we want to do as a vaccine program as well is put a legacy project in place so that people feel confident about taking up other vaccines as well. We do still have issues across other vaccines and immunizations, and the way that we're going to do this is by locally working with our community and faith leaders, making sure that we create different places to get the vaccine so that communities know that we care about them and that we care about their needs being reflected. So as Nadhim Zahawi mentioned, we have over 200 different pop-up spaces, whether that is in mosques or temples or in a vaccine taxi driving around the north end of London. We will do whatever it takes to make this vaccine accessible and for people to feel confident taking it up.
Kevin Fortune, I want to bring in Nadhim Zahawi, but Kevin Fortune, for you, how much of a problem is it, that sort of deep-seated mistrust? I think David Olusoga, the historian, was talking about that this morning. It does indeed go back centuries. How do you overcome that in such a short space of time?
Are you talking to me?
I was talking to Professor Fenton.
Okay.
So thank you. I think there are a few things that we need to do, both with pace, but also with authenticity. So the first is what Prince Charles said at the beginning of the conversation this morning, which is meeting communities where they're at and understanding that the ways in which communities are both receiving information and processing that information differs, because it depends on their ability to understand the issues which are being discussed, the languages which are being promoted, the channels through which the messages are being delivered. So for many of our communities, certainly in London, we're doing a lot of outreach and engagement work to meet communities where they're at. Second, listening to the concerns and really providing the answers that address those concerns. In speaking to communities in London, I consistently hear people ask about the content of the vaccine, the safety profile. Were the vaccines rushed? Were any people of color in the trials which were done? For all of those questions, we have the answers and we can show the data. And that goes a long way to restore trust. Finally, there's something about consistency, that we don't view this as a one-off event, where because for many communities, they feel that there's a pressure to engage on the vaccines, that we're coming in, trying to encourage them and then leaving. As Nikita has said, we have an opportunity now to create a different, better, and deeper relationship with our communities, which I hope will not only be beneficial for the COVID vaccine, whether this round, but subsequent COVID vaccines, but other areas where we've been really struggling to engage Black, Asian, and minority ethnic communities, for screening for cancer, for example, taking up other vaccinations. So this process of building trust, if done well, can really have dividends for many other health challenges up ahead.
Nadhim, Zahawi, is this a problem for the government? Is there a lack of trust around confronting racism, attitudes towards minorities, deprivation? If communities don't trust in the government, how can they trust the vaccine?
So I think, look, the positive aspect of this is vaccine acceptance is the highest in the world in the United Kingdom amongst all adults. We've also seen a really positive move. If you look at the 70 to 74-year-olds, I think the vaccine messaging, both the sort of national strategy, the regional and the local strategy, which was part of my uptake plan that I launched on the 13th, is beginning to work. Our work with local government, and we have the ex-chief executive of Southwark Council joined as COO of the deployment campaign, Eleanor Kelly, where we're creating a hub where we can share best practice. So for Professor Fenton and others, they can put into that hub the things that have worked with particular communities. Access is equally important, which is what we've found out from the evidence, i.e., some people work shifts. If you are in social care, you want to be able to have the vaccine available to you at a time that is convenient to you. Access, as the Prince of Wales has outlined, in a place that you trust, whether it's a Gurdwara or a temple or a mosque or a cathedral. And then, of course, communication. We're translating all the communication into about 20 languages, from Arabic to Farsi to Kurdish to Hindu to Polish, to make sure that people get all the information available to them to make those decisions. And then, of course, those community leaders, we're putting £23 million for community champion program to identify and work with and give resources to faith and community leaders in those areas. And the NHS is now doing a fantastic job of going at postcode level and looking at uptake and seeing whether, as Nick Kanani just pointed out, whether we put in a bus that goes into that community and vaccinates, or in their local place that they are familiar with and trust. So a lot of work in this area to make sure we leave no community behind. Everybody gets the opportunity to be vaccinated. And in the chat, I saw in there something quite important, which is the younger generation, which we will get to, obviously, after we do the over 50s. And Ruthula, I hope both you and I get to have our vaccine. I was part of the Novavax trial, so I'd have to get myself out of that trial, and they would have to tell me whether I've had the placebo or the vaccine, then I can be vaccinated when it's my turn. But then the younger generation, who have, we know also the evidence suggests they have a big impact on their, mothers, fathers, grandparents, uncles, aunts, need to also, I think, we need to engage with them in terms of why it's important for them to take the vaccine. As we get more data on transmission and the impact on transmission, the Oxford team has some very good data that it reduces transmission by 67%. That's great, but it has to be obviously peer reviewed. Our own Public Health England work will hopefully demonstrate that impact on transmission, so that younger people can also join in, say, look, it's good for you to protect you, but it also protects your family and your community from that infection. So a big project, really important work. And I think we have to find those voices that people really do listen to and trust.
We just have a few minutes left, and I really want to get through some questions because there are so many of them. I'm going to begin with Mukhtar Karim. He's a big supporter of the British Asian Trust, and it's for you, Adar Poonawalla. He says, I commend the Serum Institute's leadership and visionary approach to building capacity to produce vaccines at quantity and affordable prices. But he asks, beyond supplying what India needs, do you feel a duty to supply less economically developed countries?
Absolutely. In fact, our company has always focused on supplying vaccines to the developing world countries, namely Africa, South America, and other island countries, because they generally don't get access from Western larger pharmaceutical companies whose product pricing is a little more expensive because their costs are higher and other reasons. So, in fact, we've already shipped out to more than 25 to 30 countries. Balancing very much, despite huge pressures in India to maintain a lot of vaccine supply for India as well. So, I've been doing a balancing act to ship out at least 30 to 40% of my monthly capacity to other nations. And very soon we're going to be shipping out some vaccines, even to the UK, in the next month, hopefully. Right now the UK MHRA inspection was just concluded in India. And so I think Minister Zahawi will probably fill everyone in on that when it's appropriate. But, so we've tried to export to as many countries that need extra capacity, and, especially to the countries that have been doing such an excellent job in vaccinating so quickly. With the UK as an example, you should be congratulated. Even if you compare to India, which is home to some of the largest vaccine manufacturers, the UK has vaccinated, I think, almost 20% or more of its population already with the first dose, and very close to getting on with the second dose as well. So, it's all good news, but I think everyone's going to have to wait, unfortunately, for other manufacturers also to scale up. And then very soon, I think in about 6 months, we'll have enough supply to all these other countries.
Not too much time left. I want to get through a few more questions. Farida Fortune, Sabah Shokat from Capita asks, what can we do about social media companies who spread and amplify fake news? And she points out that the rumor that went round about inhaling steam would eradicate coronavirus, or the Bill Gates vaccination chip that was going to be put into everybody.
Unfortunately, unless those media companies do something about it, it will still continue. And once one bit of fake news is put out, it's amazing how quickly it travels. What we also need is people watching for those and actually then putting out the appropriate information, which I haven't seen being done. I do want to say, though, the British are wonderful when their backs are against the wall, and people here have done very well. So I don't want to underline that. But the other thing is, we also have to think about, we have 10% of the world going to have 80% of the vaccine, and then we're going to get all the variation. And then we're going to get all the variants. And if you look at Africa, the first wave, they had almost nothing. It's because their population's under 25. If you look now, the South African variant is just moving up. The whole right to Malawi is now devastated. We have a responsibility to do something, because if we don't get on top of that, it's going to affect us as well.
Very briefly then, this is a slightly complicated question, Nikita Kanani, but I'm going to make it the last one. Akhil Paul asks, what's the truth behind the vaccine making changes in DNA?
There is no truth behind that. It's not possible to, because of the way the vaccine has been made. I really do understand that that's a question that has been around communities, but just so that it's clear, we're not able to do that. I mean, I'm not a scientist, I'm a GP, but we've spent a lot of time looking into these vaccines, and the way they're constructed is just not possible. So please be reassured, this is just like many of the other vaccines you've had, and it is your best chance at keeping well and keeping safe.
Well, there were some really good answers there, really good questions, actually, and I'm sorry we couldn't get to more of them. I did try to weave some through as well. But thank you very much to our audience for all your contribution, and thank you very much especially to our panel for giving us so much insight and explanation into this process. I hope we've answered some of the queries and can offer some reassurance. That is all we have time for. Thank you very much to Nadhim Zahawi, the Minister for COVID Vaccine Deployment, and also Minister for Business and Industry. Thank you to Adar Poonawalla, CEO of the Serum Institute of India, to Professor Kevin Fenton, London Regional Director at Public Health England, to Professor Farida Fortune, Professor of Medicine at QMUL and Barts, to Dr. Nikita Kanani, the Medical Director for Primary Care, NHS England and NHS Improvement. Thanks also to Sadiq Khan, the Mayor of London, for his contribution, and of course to His Royal Highness, the Prince of Wales. All that remains for me is to pass the baton on, or should that be a syringe? Probably should be a syringe, shouldn't it? To the board member and trustee of the British Asian Trust, Asif Rangunwala. Asif, over to you.
Good morning, everybody. Thank you, Ritula. And let me just do a quick summing up. The take-home value from today is very simple. We all need to take the vaccine. Encourage your friends, your contacts, your acquaintances. I think we owe it as a duty of being a citizen of the UK to take these vaccines. And maybe some of us, very few of us, might not want to, but I think you need to give the protection to those vulnerable people around yourself. So my one big take-home value is that let's all get vaccinated, and I think that's what's needed. I think today's webinar and the attendance proves that people were very interested to know what the experts have to say, and I must say that this webinar should go live or should go onto YouTube and other channels where a lot of the questions that a lot of us had were answered. So thank you very much to the panel, especially to His Royal Highness, who kicked this thing off, our minister, Mr. Zahawi, and his government, who have done such a brilliant effort in, I think, putting the UK as #1 in vaccinations, Adar and his family for the great initiative that they've taken. They've made all South Asians proud because they've really been in the forefront to take this. Professor Fenton, Professor Farida Fortune, Dr. Nikita Kanani. I want to thank all of you for taking your time and sharing your thoughts with us. Thank you very much, everybody.